Welcome, everyone. Thank you for joining us today. My name is Sina Haynes, and I am your VP for Professional Development. Before we get started with our webinar, I wanted to share a few opening remarks and housekeeping announcements. This webinar is being recorded and will be made available free to our NAP members. All attendees have been placed in silent mode, so please post any questions that arise into the chat feature of Zoom so I can field those questions to our speakers as part of our Q&A process before we conclude this webinar. Our session today, Interprofessional Collaboration Through Knowledge and Technology, will explore how the healthcare community is turning to interprofessional care teams to deliver the highest quality of care and increase quality outcomes. Through this model, a well-rounded team of clinical experts work from the same evidence-based playbook to collaborate on an effective treatment plan, caring for the patient in a holistic way. A team of healthcare professionals from EBSCO Information Services explore this rising model and why it's taking the healthcare community by storm. And now I have the pleasure of introducing our speakers. Diane Hanson is the Chief Nursing Officer for EBSCO Health and Editor-in-Chief, Dynamic Health at EBSCO Information Services. After spending several years working in a hospital organization in various clinical and leadership positions, Diane has been focused on improving quality and evidence-based practice at the point of care through clinical decision support, health informatics, and analytics. Michelle Troseth is the Clinical Effectiveness Officer for EBSCO Health at EBSCO Information Services. In her various leadership roles in health systems and industry, Michelle has made significant contributions of applying evidence-based practice at the point of care by leveraging health information technology. She is a strong advocate for interprofessional care delivery that is inclusive of patients and families. Eileen Yoshida is the Deputy Editor of Medication and Clinical Infomatics for EBSCO Health at EBSCO Information Services. Eileen began her career as a hospital-based clinical pharmacist and led numerous interprofessional teams in a variety of projects for both pharmacy and hospitals. Eileen also has extensive experience in EHR implementation, knowledge management, and clinical informatics. She is also a published author and speaker. She continues to precept and mentor students and young professionals interested in a career in healthcare, including health information technology. And finally, Jessica Bartell is the Chief Medical Officer, Clinical Decision Support at EBSCO Health. She is a practicing primary care internal medicine physician with experience working in academic and community health centers, health plans, and health IT. She has held leadership roles in population health and value-based care programs, quality improvement, informatics, and analytics. She has led numerous projects related to implementation of team-based care. We're so excited to have this esteemed panel with us, and I will turn the presentation over now to Michelle and join you guys again in a little bit. Thank you.
Great. Thank you so much, Sina, and hello, everyone. I know I'm not a stranger to NAP members as your immediate past president, and I wear several hats, as you know, and today I'm so pleased to be with my EBSCO Health Interprofessional team, and I'm also grateful to the NAP sponsorship committee that really invited us as a result of our sponsorship to share a little bit about what EBSCO Health does. So we wanted to start out with the World Health Organization of Interprofessional Collaborative Practice. And that occurs when multiple health workers from different professional backgrounds provide comprehensive services by working with patients, their families, carers, and communities to deliver the highest quality of care across settings. And that definition really helps to inform EBSCO Health and our strategies as we work with communities across the globe. The next slide shows that the interprofessional care team is really comprised of a lot of different professional roles. We feel a lot of affinity towards the National Academies of Practice because of the interprofessional nature of your professional organization. And we think that it's really critical that the patient, family, and community are always at the center of what we do as far as our mission. And knowing our own and our professional colleagues' scope of practice is also critical for us to experience the highest quality of professional practice and collaborative practice possible. So this picture kind of depicts who we mean when we talk about the interprofessional care team. The next slide shows an article that I wrote in 2017, and I was asked to write this article because of the impact we were seeing across the country on interprofessional collaboration and health information technology. And this article talks about key considerations to consider when designing systems, including learning how individual and team competency is a polarity that must be leveraged in intentionally designed systems. We have to really consider both. And we hope that you reflect on your current knowledge and technology solutions as you listen to us today and how well they are balanced and integrated. The next slide shows our reality in healthcare all too often today. Breaking healthcare silos is critical to ensuring safe quality care. That's the very first line in the article in the previous slide. Sometimes care is still delivered in this fashion, and it puts clinicians and patients at risk. Another reason that we all need to keep the patient, family, and community in the center. This is especially true during transitions of care where patients are most vulnerable to lost or miscommunication regarding their care needs. And now we're going to move into our solutions and looking at the big healthcare landscape. Diane?
Thank you, Michelle. Well, as many of you know, healthcare organizations have been really organizing around the quadruple aim and really looking at evaluating how they're delivering service and around these four really important quadrants. And so, you know, as we all focus on achieving this quadruple aim of an excellent patient experience, reducing our cost of care, managing populations and population health, and then really focusing also on clinician well-being, it's important to note that meeting the aspirations of the quadruple aim absolutely requires an interprofessional approach to care. No one discipline can effectively care for a patient on their own at the individual level, and certainly as we look at goals of each of the aims, we cannot achieve the quadruple aim without an integrated interprofessional competencies. Weaved kind of throughout all four of the aims. And so as Michelle talked about the silos, I think each of the disciplines have been trying to tackle much of the quadruple aim alone. And so what we're really proposing is that as an interprofessional care team, we need to look at this collectively across the continuum of care. And one of my favorite quotes is an African proverb, which says, if you want to go fast, go alone. If you want to go far, go together. And so the quadruple aim provides us with this really strong framework so that we can travel together as an interprofessional colleagues and team and create that sustainable healthcare system that we all strive for. And so the next slide is really important because really interprofessional collaboration across the continuum of care doesn't magically happen on its own. It takes an intentional focus on some very key best practices that we've learned over the course of multiple years in working in interprofessional teams. It's important that care providers have a really clear understanding of their own scope of practice, professionally and by licensure. It's amazing how many care providers cannot stand up in a room and actually state their scope of practice word for word. And so it's an important thing to evaluate as a care clinician. It's equally important to really have an awareness of other disciplines' scope of practice. This allows for that best coordination within and across integrated care teams and when caring for patients. Point of care tools and resources that are specifically and intentionally designed to support an integrated team can really help at improving communication and knowledge sharing, and then care coordination around the plan for the patient. This includes using and applying the same sources of evidence in providing care and supports shared decision-making with patients and families, including them in the care team and the approach that we take. Interprofessional collaboration occurs more easily when infrastructure is designed and implemented with this end in mind. How meetings are conducted, how tools are developed, policy is decided, can all be accomplished using an interprofessional team versus working in those silos. So infrastructure support is so important to hardwire collaboration. And with that, I'm going to turn it over to Eileen.
Thanks, Diane. At EBSCO Health, we provide evidence-based information, nursing skills, allied health resources, healthcare business intelligence, research tools, and so much more. We know, just as Diane mentioned, that interprofessional care teams play a vital role in improving patient care and quality outcomes by treating the whole patient. And in order to do that, all healthcare team members must be on the same page regarding the information and resources they use. Our suite of evidence-based point-of-care resources will give you that exact support. Next slide. Our content is created by an interprofessional team of physicians, nurses, pharmacists, rehab medicine professionals, dietitians, and social workers to ensure continuity of care by providing trusted information and patient education materials that work cohesively across the different practices. The information is presented in an easily digestible format that map to the unique workflows of each team member at the point of care. Additional content is included in medical databases and journals, ebooks, and e-journals. Next slide. Here's a quick snapshot highlighting just some of our solutions. I'll tell you about just a few of them. Dynamed is a clinician-focused point-of-care reference tool designed to answer clinical questions often faced by busy physicians. Every day at Dynamed, a team of clinicians and evidence-based methodologists systematically survey the emerging medical literature to identify clinically relevant information, determine its reliability through critical appraisal, and synthesize it into Dynamed. In addition, clinical practice guidelines from across the globe are monitored daily and incorporated into Dynamed. In this way, our users can be assured that they are using the most current and objective information when taking care of their patients. Dynamic Health is our nursing and allied health point-of-care reference tool. The content is crafted by a team of nurses and allied health professionals who review the evidence and write original content based on best practice. Dynamic Health includes thousands of nursing and allied health skills, videos and images, as well as drug content. Both Dynamed and Dynamic Health are available in a mobile responsive interface and can also be integrated into the electronic health record and the intranet. Dynamic Health is also available through learning management systems, including HealthStream, who is our preferred provider. With NRC Plus, nurses can master best practices, get answers to questions quickly, access care plans, watch videos, strengthening their skills and learning and earning CE. NRC Plus includes core measures, care plans, nursing management and leadership topics, skills checklists, patient ed, and more videos and images. Finally, EBSCO Health also supports organizations' educational goals. Our tools encourage students within the various healthcare professions to access original research, practice evidence-based medicine, and enhance their clinical skills. Academic medical centers, as well as schools of medical, nursing, and pharmacy, use our products to teach aspiring clinicians to take care of their patients. Next slide. And best of all, clinicians can search multiple resources at the same time with a single search box. With EBSCO Discovery Service Health, an entire library's collection of databases and ebooks can be accessed via one search, making it quick and efficient for clinicians, students, researchers to find the information they need. Next slide. Which means that all of an institution's content and information resources can be combined into one platform, increasing visibility and usage and maximizing the institution's return on investment. And now I'm going to turn it back over to Diane to tell you a little bit more about our editorial process.
Thank you, Eileen. As Eileen mentioned, it's really important that an interprofessional team uses the same evidence in making decisions at the point of care, again, crafted for their scope of practice. And so to assure that the best evidence is represented in EBSCO's point of care tools, our interprofessional team of writers and editors utilizes a consistent evidence-based methodology. It's a 7-step process that starts with identifying all the available evidence to answer a clinical question. So we have access to all the randomized controlled trials, every study, every guideline, every book, journal that you could imagine, right? All of the sources of evidence that change over on an ongoing basis. So we don't look at just a subset, we look at everything. It's a very, very broad view of the evidence sources that are there. And I think that's a really important distinction in that we're not a traditional publisher, and so we have the freedom to look at everything that's available that's evidence-based on the particular subject. And so it does start with identifying that key clinical question as well, which is really important, how you ask the question and what you're looking for in getting your answer. And then once all of the evidence is uncovered, then selecting the best evidence is based on a set of criteria and relevance. So we'll look at the type of study, we'll look at its relevance to the clinical question, we'll also look to see if there's bias in those set of studies, and really choose the very best sources as we move to the next steps with clinical appraisal. So from there, each resource is then clinically appraised, it's objectively reported, meaning we will look at every particular piece of evidence and objectively report what the findings are, and then show how we've synthesized that evidence. And then EBSCO reports conclusions and they make recommendations based on that synthesis, and that gets distributed across the products. And the process is ongoing. We have a systematic literature search team that looks at all of the available evidence that comes in on a daily basis, and in real time we'll make adjustments to the conclusions that have been made based on new evidence that is published. And so it's quite a strict methodology. All of our products utilize the same methodology, so there's a lot of consistency. And so the evidence that's placed in the particular scope of practice for our interprofessional team is based on the very best evidence that we've synthesized. So the next slide also shows another important aspect of our evidence-based practice is that we combine that with clinical expertise. So EBSCO utilizes a wide network of interprofessional clinical experts, nationally and internationally, to provide critical clinical review as part of our quality assurance process. So this is a really important part to our editorial process, because you can never have on one team every clinical expertise and specialty area. And so this gives us an opportunity to really seek editorial excellence by reaching out to this network and tapping the interprofessional clinical feedback that we can obtain before any of our topics are published. So we have this network that's there every step of the way. So it really creates a strong, credible process, and it augments the evidence, really supporting the definition of evidence-based practice and combining the evidence with clinical expertise and then putting it in the context of the patient. And so shared decision-making is the next topic we're going to talk about. And so I'm going to hand it over to Jessica, and she'll go deeper there on how we bring the patient into the equation.
Thanks, Diane. Hello, everyone. I wanted to share an example of a new set of products that we are working on. As you know, EBSCO Health has a long and respected history of development of evidence-based content for different users. We have a new focus, or rapidly growing investment and emphasis on clinical decision support and bringing insights to the point of care. And specifically, we have focused on shared decision-making as a primary emphasis in those tools. As Diane said, evidence-based practice is a critical piece of this, but taking into account patient preferences is the other side of shared decision-making. And that really requires then participation of the patient as a member of the interprofessional care team. And it brings in many different practitioners of different sorts as well. Shared decision-making is an opportunity to bake in interprofessional care because by definition it requires collaboration and allows clinicians and providers to work at the best top of their license and taking into account their scope of practice and their unique skill sets. So next slide, please. So the benefits of doing shared decision-making is that it does lead to better decisions. So it increases the patient's knowledge of the risks of certain procedures or tests, the benefits and harms of the different options for treatment, so that they have a more accurate perception of risk. And in fact, they often, based on more information, make more conservative decisions that are better for them and have less risk of downstream complications or unhappiness. There's a better congruence between values and choice and reduced costs, improved adherence, and better communication. So all kinds of good benefits of this shared decision making. And it's a new frontier because it is not the traditional user-specific content, but rather the interplay in giving content to different users in at different points of time and relying on the overlap or the communication that happens because of that information. Next slide, please. So shared decision-making, the benefit of focusing on this area is that we can also focus across clinical settings, not just across the clinical care team. Traditionally, vendors provide information to a particular user in a particular setting. So shared decision-making by definition is team-based, and the cross-disciplinary approach is necessary because these decisions are happening in many different settings with interactions with many different team members over time. So examples, the patient at home can be considering before a visit to his or her clinician whether they want to have a mammogram screening, how they might manage their depression, colon cancer screening options, and so on. And so that pre-work of educating the patient in patient-friendly language is a critical piece of the shared decision-making process. In the hospital, shared decision-making is very important in, for example, reviewing discharge options, thinking about end-of-life decisions involving code status or advanced directives. And then in the clinic, many different shared decision-making situations where a physician or another clinical team member may be reviewing benefits and harms of anticipated procedures or tests. Knee replacement surgery, statin therapy, or anticoagulation. So many different places this comes up, and it just requires a team approach and thinking about how to deliver that information most effectively. Next slide, please. So finally, bringing it all together, what the shared decision-making use case does for us, it helps to catalyze our effort to bring together our technology as well as our content for all of our different interprofessional care team users, and to bring that to the right place at the right time in the right format for use in that shared decision-making conversation. So it really is trying to orchestrate effective healthcare by bringing it all together and hopefully breaking down silos and helping us to achieve the quadruple aim. So that's it for my piece. I think I turn it back over now to Michelle.
Yes, thank you so much. And just want to thank my interprofessional panel here from EBSCO Health today. And we're very excited to let everyone know that we will be at the 2020 annual meeting and forum again. We are going to be a sponsor again. We're very much looking forward to traveling to San Diego and networking in the hub with all the other sponsors. And 3 of us on the panel are actually fellows in the National Academy of Practice, and it's been fun to introduce NAP to Jessica Bartell as well. So we want to thank you for your time today, and I'm going to turn it over to Sina to see if any questions came through the chat box.
Thank you so much, Michelle. I am not actually seeing any questions come through, but I do want to pause and see. Here comes one. So I think that this is a question regarding, I guess, an opportunity for folks that may be interested in looking at these services and how best to make contact, which we're seeing here. Email addresses are provided. I know there'll probably be opportunities, certainly at the forum, to visit with our representatives who are on the webinar who may be attending, certainly Michelle and others attending the annual meeting and forum, who would love to discuss further about all these robust programs and services to really help support interprofessional collaboration. And we have thanks coming in from members who are joining us today for this outstanding webinar. Couldn't agree more. And I would encourage you to certainly reach out. We're so thankful that EBSCO has given us this opportunity to highlight and showcase the services that they provide. As Michelle said, we very much look forward to seeing you at the annual meeting and forum. And thank you all so much for joining our webinar today. Have a great rest of your day. Thank you.